Good morning. My name is Kelly Banco. I am representing Liberty University through the School of Nursing, and today we're going to be talking about the Black Maternal Health Momnibus Act of 2021 and why it is imperative we get this act legalized and in policy today. So, just a brief overview of the bill. The United States is facing a maternal health crisis that disproportionately affects Black women. This consequence is of systemic racism, implicit bias in healthcare, unequal access to quality care, and also broader social determinants of health such as housing, nutrition, and employment. In response to this crisis, Representatives Lauren Underwood and Alma Adams, as well as Senator Cory Booker, introduced the Black Maternal Health Momnibus Act of 2021. Its original form was developed in 2020, obviously for it to be presented in 2021, but back then it was only 9 bills. COVID happened in 2020, as we all know, and that highlighted the fragility that is women's health care. So it was expanded from 9 bills up to 12. Even though it is not enacted or adopted in its entirety, it is still supported by more than 200 organizations. We're going to get more into that later. These comprises of 12 individual provisions aimed at addressing various dimensions of the Black maternal health crisis. For example, the Social Determinants for Moms Act invests in housing, transportation, nutrition, and environmental conditions, all of which are critical for healthy pregnancies. In addition to that, the Protecting Moms Who Served Act works to improve maternal health outcomes for veterans, as Black women are overrepresented among female veterans. This bill mandates that the VA prioritizes maternal health and equity. So let's go over the literature review as well as support what the problem is. The Momnibus Act is a response to the deep and persistent social inequities that shape maternal health outcomes in the United States. Research consistently shows that Black women face greater risks of severe maternal morbidity and mortality. Over 80% of pregnancy-related deaths in the United States are preventable, but Black women still receive less time and lower quality care during pregnancy and childbirth, thus contributing to higher risks. Black women also often feel unheard or invalidated, and that also exacerbates poor outcomes. If you feel unheard in a clinical setting, you're probably not going to say when something's wrong because you may feel like, what's the point? Black women are most likely to experience housing discrimination as well, and employment insecurity in unsafe neighborhoods. The Momnibus Act explicitly addresses these by funding community-based organizations as well as diversifying the workforce. But it goes beyond that. Just politically, each preventable maternal death can cost the healthcare system between $500,000 and $1 million after everything is settled and families are taken care of after the fact. So the Black Maternal Health Momnibus Act of 2021 has garnered widespread support from a diverse coalition of healthcare professionals, advocacy organizations, and policy leaders. The ACOG supports the bill's multifaceted approach to maternal health, citing its alignment with evidence-based practices and its emphasis on racial equity. The ANA has also endorsed this act, highlighting its consistency with the ANA Code of Ethics, which mandates the nursing profession to advocate for equitable, person-centered, and culturally responsive care. Additionally, the March of Dimes has actively promoted the bill, noting how it empowers local community-based organizations and expands access to doulas, midwives, mental health care, and social services. However, with everything, there's always going to be a critic. The Cato Institute and Heritage Foundation argue that maternal health should be addressed at the state level and warn that creating new federal programs could lead to inefficiencies or bureaucratic redundancy. These critics also suggest that the bill overcomplicates maternal health by incorporating social determinants that fall outside clinical care. However, I don't quite agree with those oppositions. As nurses, we are always taught to be holistic, to look beyond what the surface level problem is. And therefore, I agree with what Chambers says, stating that this bill aligns with core principles of social work and human services practice, particularly those emphasizing social determinants of health. The human services sector emphasizes that maternal health disparities cannot be solved in isolation from broader conditions of inequality that shape people's lives. Isaiah 117 teaches, "Learn to do right, seek justice, defend the oppressed, take up the cause of the fatherless, plead the case of the widow." This verse calls for active pursuit of justice, especially for those marginalized or mistreated, which this act does. So, why does America need this bill? The Black Maternal Health Momnibus Act of 2021 represents one of the most comprehensive legislative efforts ever introduced to address the maternal mortality crisis in the United States. This bill is ambitious. It is a multi-part legislative package that aims to close racial disparities and therefore improve maternal health outcomes. It's going to achieve this by investing in the community-based organizations, mental health resources, work to diversify that workforce, and as well improve data collection. It recognizes the interconnected roles of systemic racism, economic inequality, housing instability, environmental conditions, and mental health and maternal outcomes. The core strength of this act lies in its comprehensive approach, and this is something America is lacking and something that we need to help prevent further unnecessary deaths from happening. So let's look a bit more at the data. The CDC shows that Black women are 3.2 more times likely to die from pregnancy-related causes than white women. Absolutely unacceptable. In 2020, the maternal mortality rate for Black women were 55.3 deaths per 100,000 live births, compared to the 19.1 deaths for white women. Over 80% of maternal deaths are considered preventable, indicating a systemic failure in addressing these disparities. California's Maternal Quality Care Collaborative looked at how we actually have done with adopting parts of this act, and it actually reduced the state's maternal mortality rate by 55%. So that even just shows right now that the little bits and pieces of this act that have been adopted and enacted are actually working and saving lives. Quantitatively, the Black Mamas Matter Alliance took a survey, and these participants consistently reported feeling dismissed, unheard, or racially profiled during prenatal visits and childbirth. One woman even said, "I had to bring my white friend with me just so the doctor would take my concerns seriously." It is time we do something to stop this from happening. While the bill is fundamentally sound and should be enacted, several areas could be improved to ensure more rigorous oversight and stronger accountability. It should be able to require states and funded agencies to submit annual progress report with measurable metrics on maternal health outcomes, racial disparity, and funding utilization. Sharing this transparent data will ensure programs have consistent implementation and also be able to better track progress. This act can also include more detailed guidance on state-level coordination, particularly for Medicaid extension and community-based funding. This can help prevent disparities across regions as states vary widely in political will and infrastructure. Lastly, a recommended revision is that this act can adopt or create a formula to direct a proportion of funds to areas with the highest maternal mortality and morbidity rates. And this will help prioritize funding based on needs. So, through its comprehensive, evidence-based, and equity-driven approach, this act addresses not only clinical outcomes, but also the broader social, economic, and structural determinants of maternal health. It is deeply embedded in historical inequities, institutional bias, and policy failures. Quantitative data reveals alarming disparities in outcomes, while qualitative accounts provide heartbreaking testimonies of mistreatment, neglect, and disrespect. This stands as one of the most significant legislative responses to a long-standing crisis of maternal health disparities in the United States. But this crisis is neither random nor does it have to be inevitable. This offers a tangible, holistic pathway forward through investment in community-based care, improved data system, a diversified perinatal workforce, and enhanced access to mental health and social services. This act is not only practical, but ethical. It embodies core values such as justice, compassion, and respect for human dignity. So with this, I would like to end with this verse from Matthew 25:40. Truly, I tell you, just as you did it to one of the least of these, who are members of my family, you did it to me. Jesus identifies with the least of these, showing that every person, no matter how marginalized, possesses intrinsic worth, and it is up to us to respect that worth and human dignity. Here are all of the references that I used to put this presentation together, and I thank you for listening.